Good evening and thank you for joining us for KREM 2 News at 6. I'm Mark Hanrahan.
And I'm Tom Sherry. Whitney Ward is off this evening.
Well, it is clear that we are facing a new wave of the pandemic with the Delta variant of COVID-19, and we're hearing a lot of pretty scary stuff from elected leaders and public health experts. But just how bad is this wave really?
So we want to look into the data with KREM 2's Casey Decker right here. So Casey, how bad is it?
Yeah, well, unfortunately, guys, it is pretty bad. The data is reflecting a lot of the rhetoric that we're seeing right now. Let's go ahead and dive into it. Let's go to the wall and look at some of the actual numbers, the data that we're getting from the Washington Department of Health. This is all Spokane County data. We'll start off with just the case numbers, right? That's the first number that everyone looks to. And you can see right here, we took a dip down in early June, but now we are headed straight back up. This is a very steep curve. That is pretty frightening. And you can see it's comparable to the wave we had in April of this year when we were worried about going back in phases. And it's larger than the wave we saw last summer. This was during the time when everything was locked down. So these cases are shooting back up, though, of course, you'll notice here, nowhere near as bad as we had last winter, but still pretty scary. And especially the steepness of this curve is really something we haven't seen since this really bad wave that we had in the wintertime. But of course, case numbers aren't the metric that we really care about too much. At the end of the day, what really seems to matter is hospitalizations, right? Because that's the one that shows people how sick people are really getting. So let's look at that one too. And you can see here again, it is a pretty steep curve shooting up. Very concerning again. Not as bad hospitalizations wise so far as what we saw in April. Certainly not as bad as what we saw over the winter, but about comparable or worse to what we were seeing in that first year of the pandemic. So this has been very concerning. We heard from the governor the other day that this is one of the main reasons he's mandating that state employees and healthcare workers be vaccinated. So this is one of the numbers that we're going to be tracking very closely. Now you might be asking, is there any good news here? Well, there is some, depending on how you look at it. Now, obviously, we want to get down to 0 deaths, but if you take a look at this chart here, you can see some positive trends, right? So obviously, this wave had a lot of COVID deaths. This wave in the summer of 2020 and the very first wave in the spring of 2020 were all pretty deadly. But since then, the waves have actually not been super deadly, including in April and the Delta wave that we're seeing right now. These have mostly averaged just 1 or 2 deaths every couple of days. So obviously still we want to get that down to 0, but it is not as deadly as we've been seeing in the past. Now the other thing we want to show you is this model. Now this is a statewide forecast from the University of Washington, and it's important to note that this of course is just a model, but it deals with hospital resource use. In other words, how many beds are being used, how many beds are left. And you can take a look at this here. Over the course of time, obviously there's been the waves, there's been the spikes. Right now it is heading up, and here is the forecast, right? Here is what it's showing for the rest of the fall towards the end of the year. And you can see that this number right here, this is the total number of beds being used, and they're forecasting that it could be worse than any other part of the entire pandemic. That's how bad this Delta variant could get if things don't get under control. So if that isn't more evidence to tell you go get vaccinated, I don't know what is. Mark, Tom?
Casey, thank you very much. The Spokane Regional Health District released new numbers today. They report 277 new cases today, and they say there are 116 COVID patients hospitalized right now. These are numbers that we haven't seen for quite some time. They say 50.5% of Spokane County residents ages 12 and older are now fully vaccinated.
Well, the Panhandle Health District is reporting 106 new cases across Idaho's 5 northern counties today. There are currently 72 patients hospitalized with the coronavirus. The Panhandle Health District said this week's percent of positivity has been increasing and ranges from 5 to 23% of increased positivity.
Well, this latest surge certainly putting pressure on our local hospitals.
KREM 2's Ian Smay joins us now from the newsroom with how hospitals are responding. Ian.
Yeah, good evening, Mark and Tom. Providence and Multicare, the 2 major healthcare providers locally, have both said some elective surgeries are being postponed. To be clear, those are surgeries that aren't for a life-threatening condition, such as a joint replacement. Providence has told us that they don't single out one type of elective surgery when it comes to deciding which to postpone. Providence spokesperson Ariana Lake says they don't have an estimate for how many surgeries are being postponed, saying that it is evaluated each day as the number of COVID-19 patients changes. Providence also doesn't have an estimate on how long surgeries will be delayed, as again, it is tied to that number of COVID-19 patients. They also said that this is a unique situation and that Providence doesn't usually have to delay surgeries, saying that the pandemic is the major factor behind these delays. Lake also says they try to alert patients that their surgeries are being postponed as soon as possible by calling them on the phone. She also recommends that people call their physician if they have questions about an upcoming surgery. And over at Multicare, spokesperson Kevin Maloney said in an email to KREM that patient volume changes regularly, even during normal times. Multicare has seen an increased need for ICU care due to the COVID-19 cases that are surging. Maloney did say that some elective surgeries have been postponed, but stressed it isn't all elective surgeries that are being affected. In North Idaho, Kootenai Health has said it is delaying all elective surgeries that can be delayed for 6 to 8 weeks so they can move staff to care for hospitalized patients. That comes as leaders say Kootenai Health has been near capacity since early spring. Also, just about an hour ago, we learned from Kootenai Health that they are tightening their visitor restrictions starting Thursday due to the surge in patients. Non-COVID patients will now be allowed only 1 visitor per day, and those visitors must wear a mask while at Kootenai Health. Visitors must also be 18 years or older except for in situations of end of life. Patients in the inpatient and emergency departments are also allowed 1 visitor a day, assuming they aren't COVID positive or awaiting a COVID test result. Kootenai Health is also extending the hours at its testing center starting this Friday. The testing center will be open 8 a.m. to 4 p.m. Monday through Friday and will be open 8 a.m. to 1 p.m. on weekends. Now, to be tested at the Kootenai Health Testing Center, you must have an order from your medical provider. And one thing that Maloney stressed was that the best thing people can do to help the situation right now is to get vaccinated. He says that with the increasing prevalence of COVID-19 variants such as that Delta variant, the best thing you can do to protect yourself is to get a COVID-19 vaccine. In the newsroom, Ian Smay, KREM 2 News.
Ian, thank you very much. We want to make sure that you're getting more to every story, so we have made finding the information easy for you. If you would like to read more about the latest COVID surge in the inland Northwest, including about hospitalizations and vaccine mandates, just text the word vaccine to 509-448-2000 and we'll send that information directly to your phone. Well, much of eastern Washington will be under an excessive heat warning starting tomorrow and going all the way to the weekend. Tom joining us now. My goodness, these are potentially dangerous temperatures we're talking about.
Once again, this is the 3rd time this summer that it has happened. Normally we get it about once.
Right.
Everywhere you see shaded in red, and parts of this is over in western Washington as well. That excessive heat warning from Wednesday through Saturday evening as temperatures climb into the upper 90s, and in many locations later this week and into the weekend they will get above 100 degrees. What's the great news? Our air quality, because of the cooler air over the weekend and the rain on Sunday, our air quality now is at 38, which puts us firmly planted in the good zone. So take a deep breath when you go outside. Satellite radar not showing you any rain now across the area. We'll look for an overnight low tonight of 64 degrees under mostly clear skies. Hot and hazy on Wednesday. Could get up to 98 degrees. To put that in perspective, the average high, what is the average based on? 30-year averages. Over 30 years, we average about 86 degrees. We'll look for a daytime high tomorrow of 98. And then for the weekend, Friday and the weekend are hot. 101 expected on Saturday, 94 on Sunday. I do have some cooler weather, though, next week. I'll take a look at your 10-day outlook, all coming up in a few minutes.
Sounds good, Tom. Thank you very much. And that hot, dry weather is certainly not going to help in the fight against several wildfires burning all across the region. So let's start with that fire burning near the Canadian border that's so far burned about 139 acres of forested land. Here is a look at the current wildfires in the inland Northwest right now. There are several of them. The 9 mine fire started on August 4th from lightning. It's now 35% contained. It's located about a half an hour north of Kettle Falls.
The Cougar Rock Complex fire northeast of Orofino, Idaho now is about 42% contained after burning more than 8,000 acres. The complex is actually made up of 10 fires. Each of those began from lightning strikes. About 430 firefighters are battling that current fire.
There are several wildfires that we are tracking, so for an update on all the wildfires burning in our region, just text the word FIRE to 509-448-2000 and we'll send that link directly to your phone. Well, back to school season quickly upon us, and we all know how important it is for students to have the supplies they need. So coming up after the break, we'll let you know how you can get involved and make a kid's first day of school the best first day ever. We're back after a quick break.